Welcome back to another episode of Optimal Anesthesia Unveiled. Today, we're taking a fascinating journey through time to explore the evolution of premedication in anesthesia. Join us as we delve into the rich history of this crucial aspect of patient care. The story of premedication in anesthesia is an intriguing one, marked by innovation, adaptation, and a relentless pursuit of patient comfort. It's a tale that mirrors the ever-evolving landscape of medical science and surgical practice. So, let's step into the time machine and travel back through the annals of history.
Our journey begins in ancient times, long before the discovery of modern anesthesia. Imagine a world where surgery was a daunting, painful experience. To provide some relief, remedies like alcohol and opium were occasionally administered before surgical procedures. While these substances offered a degree of comfort, they couldn't replace true anesthesia. This era laid the foundation for the future development of premedication.
Fast forward to the mid-19th century, a transformative period in anesthesia history with the advent of diethyl ether, commonly known as ether. Ether revolutionized surgery by making it painless, but it came with its own set of challenges. It irritated the airways, leading to coughing, breath holding, and laryngospasms in patients undergoing anesthesia. Moreover, the induction of ether anesthesia was slow and often frightening. To address these challenges, premedication emerged as a critical practice. Anesthesia pioneers like John Adriani, drawing inspiration from the teachings of Claude Bernard, began administering drugs such as morphine, scopolamine, or atropine before the administration of ether anesthesia. Lorenzo Bruno, another notable contributor, advocated the use of morphine an hour before chloroform anesthesia to lessen psychic trauma. This marked the inception of premedication practices as we know them today. Chloroform presented different challenges. It was more potent and less pungent than ether, but it could induce premature ventricular contractions, especially in anxious patients. Henry K. Beecher, a renowned anesthesiologist, recommended the administration of morphine and atropine before chloroform anesthesia, ensuring a more comfortable experience. As we step into the 20th century, premedication continued to evolve. In 1934, Paul White introduced pentobarbital to the premedication scene, offering greater sedation and significantly reducing postoperative nausea and vomiting compared to morphine. This marked a significant advancement in premedication practices. The 1950s witnessed a groundbreaking development with the introduction of the non-pungent anesthetic, halothane. This innovation eliminated airway irritation during induction, reducing the need to mitigate airway responses. The focus shifted towards addressing patient anxiety and ensuring smoother transitions into anesthesia. In the subsequent decades, new drugs and evolving surgical practices continued to shape premedication. In the 1970s and 1980s, the use of intramuscular injections of longer-acting morphine or pentobarbital an hour before anesthesia gave way to intravenous injections of the faster-acting fentanyl, administered just moments before induction. Fentanyl proved effective in reducing the sympathetic response to tracheal intubation. Simultaneously, the 1980s introduced midazolam, a new benzodiazepine administered intravenously shortly before anesthesia induction. Midazolam quickly became the preferred choice for relieving apprehension, decreasing nausea, and inducing amnesia. Its shorter duration and reduced venous irritation made it a significant addition to premedication practices. In pediatric cases, midazolam was even administered orally to induce somnolence, making it easier for children to separate from their parents before surgery. The history of premedication and anesthesia is a testament to the dynamic nature of medical science and the ever-evolving needs of patients. From ancient attempts at pain relief to the sophisticated premedication practices of the modern era, this journey reflects the relentless pursuit of patient comfort, safety, and the quest for more effective anesthesia induction methods. And that wraps up this episode of Optimal Anesthesia Podcast. We hope you enjoyed this historical odyssey through the evolution of premedication and anesthesia. Stay tuned for more insights and discussions on optimal anesthesia practices in our future episodes. Don't forget to subscribe, rate, and review our podcast. Your feedback is invaluable. Until next time, I'm signing off.